Welcome back. We are finally on the penile thickening subject. This is a detailed subject, so I will try to remember the topics by looking at the text in my hand. First of all, this is open to complications much more than the suspensory ligament. You won't be having any problem with the elongation, but fat injection has some points that might cause complications. So I will talk about them. This procedure is done with the thin cannulas. It won't leave any mark on your skin because this tissue and this issue varies patients so much, and also penile thickness is more important when the intercourse is concerned. So I think thickness is more important if you're talking about the pleasure during the intercourse. Elongation is also important psychologically. I recommend both the elongation and the thickening to the patients, but if the patient is scared of having his suspensory ligament cut, he should only request a fat injection. If he is also scared of any scars that will be on his penis, fat injection is also a good option because there will be no scar left. Since we do it with the thin cannulas and through a small hose, thickening can be a better option for a lot of patients. But if they don't have any fat on the required areas, we cannot do it. I sometimes hear different stories. I've also done that with the removing a small patch of skin from his groin. You cannot have a good result with this. Thickness will not be the ideal. Don't do it. And there are some doctors that do it with the fillers. They use the filler that has been used in the lip filling. It is not going to be useful and dissolve very soon totally. It is also an absurd method. Some say that they implant silicone around the penis. Yes, there are some silicone prostheses, but you will be having an intercourse, a foreign object that was implanted under the skin cannot tolerate the trauma of the penetration. I think this is impossible. I've seen this in some articles. Prosthesis ruptures the skin and it pops out. Fat injection is the only and one safe method. I don't do anything except that. So the patient needs to have some fat on the abdomen. How much? I will explain that later because this is a very detailed subject. Now let's go in order. Let's start from the beginning. Fat removing is the first step of this surgery. The first remove some fat from the abdomen, but before that we do an injection to the base of the penis where the elongation will be performed. This will stop the bleeding and helps us to operate with less blood. But it will 10 minutes to kick in. So after the injection, we remove fat from the abdomen. This is the first step. We leave them and start the elongation operation because the medication starts to kick in and we do the elongation. After that, we do the thickening with the fat we've removed from the abdomen. So this surgery has 3 steps. The areas that we removed fat, our first choice is the abdomen and left and right sides. I think that this area has the best quality of fat. If it is not sufficient, we take it from the inner parts of the leg. There is also good quality fat there, and even if the patient is skinny, there will be some fat over there. We remove the fat that is around the penis, but we usually do it to thin down the tissue. We don't generally use that for thickening because the nature of that fat is a little bit different. It feels like jelly and soft. I don't think that it's an ideal for thickening. Why? Because when we inject the fat around the penis, it doesn't stay that way. Cells die their sediment thickens and turns into a scar tissue. In order for that fat to leave a good quality sediment, cells need to be as thick as possible. I don't think that there will be any fibrous tissue left with that kind of soft tissue. So we don't like that soft adipose tissue. Adipose tissue, we only remove that to thin down that area. Other than that, they sometimes ask if this surgery can be performed with local anesthesia. No, it cannot, because we remove fat from the abdomen. Cannulas with are 3-4 centimeters, but they are almost 25-30 centimeters long. When we go inside from the groin, its tip will almost reach the ribs, because we remove the fat from the whole abdomen. So we do it with general anesthesia. We do not do it otherwise. We do not do spinal or local anesthesia. You need to forget this. We thin down the adipose tissue with a special method. We transfer that to another injector to help the fat flow easily. As I have told you before, since the adipose tissue will turn into the fibrous tissue, we do not need to worry about the condition of the fat. Of course, I'm speaking my piece. On one of our meetings, some wise guy came up and said, you should be speaking for yourself. I am of course speaking for myself. You should be listening a guy who has 14 years of experience. It is really crazy. Okay? We have thinned down the fat and put that aside. When we inject it, we first do tunnelization. This procedure is a must. So what is tunnelization? We place the injection cannulas inside and we move them to be able to make a hole. We have to make these holes because if we do not do that, the adipose tissue will not be dispersed evenly around the penis. If you finish the procedure without tunnelization, the fat will remain inside just like a line and won't be dispersed. So it might leave some residue, which feels like a small nodules or cysts. In order to disperse it evenly, you have to put a lot of holes under the skin so that the fat will disperse evenly. As you can see, tunnelization is a must in this operation. This is also one of my modifications. We used to inject the fat evenly around the penis. It makes sense. Why? Because the fat is dispersed evenly then, since the penis is a round tissue. We thought it would be good, but it was wrong because the penis looks swollen in the middle. Circumcision suture looked tight, and also the base of the penis also looked tight. Middle part looked more swollen. If you do it evenly, this will be the result. We had to do some modification in order to fix that. But why? Even though you inject the fat evenly, penile skin elasticity is not the same in all areas. At the base, the skin gets thicker, then turns into the abdominal skin. It rejects the process, and we have circumcision suture right at the glands. It also rejects because it has scars on it. So, when you do it evenly, base and the glands rejects it. The most elastic part is the middle. So, penis now looks thicker in the middle and tighter in the ends. We did something to fix that. We again inject the fat evenly, but we inject some extra oil to the base and the glands. We put extra fat for those. If you want the penis look proper, You have to inject extra fat into those places or it will look like a sausage or a worm. But we want it to look even. We also need to inject the fat crosswise. We go inside in couple of places and do it crosswise in order to disperse it evenly. And when we do it, we try to do it as homogeneous as possible. One of the main points of this procedure is this, and this is also a modification made by me. A year ago, a patient came to me with a problem. I think this surgery happened in October. We performed the penile enlargement surgery last summer. He then came to me in October and said, I am pleased with the result and I have come for an extra fat injection. But something has happened and now I also want you know that. I thought it was something interesting. He says that he had sex with his girlfriend. She held the penis right at the base and she thought the base was thin. Other parts were thick, but the base was thin. This really is an interesting case. When I think about it later, I have thought that he was right. This is not a serious problem, but still needs to be fixed with a surgery. And I also think that this must be on the books as well. Penile enlargement surgeries are always explained with images in the books because this is a visual surgery. You want to enlarge your penis. It is not functional. Fat injection around the penis is something that is always talked about, okay, but sexual intercourse is not only visual but also sensual. People touch each other and if the woman holds it right from the base and press it firmly, she can hold a part that has not been injected fat yet. Normally it looks normal and thick, but when you hold it, you can feel the inner part and it doesn't feel so thick. In order to prevent that, we should do this after the thickening procedure around the penis. We also inject some fat into the inner part of it, because when you hold it from the base, you should also be able to feel the thickness. We should think more openly and think visually. We should also think sense-wise. So we need to inject fat to the part that can be felt when touched, but cannot be seen from the outside. You cannot find this in the textbook because everything in them is about visual quality. This is also misguiding us. We have been doing it like this for years, but when the woman holds the base, she can feel the thinner part which is not seen from outside. We have started to inject fat to the inner part, so even if you hold it, you can see that it is also as thick as the outer part. These modifications also belongs to us. We have been doing it for every year. I think it is very important because feedbacks are important for us. So I listen to their every problem to be able to add something useful to these surgeries. There is always something to add and it baffles me so much. Before that, I have been thinking that these surgeries were very fine and finalized and there was nothing to add on. But then we did that. So that, can I tell you more about this? We talk about the tunnelization. Okay, how much fat is injected? How many cc's? This also is an important topic and I think one of the most important ones. I will tell you some stuff that I have always been telling to my patient. The year is 2013. We went to a winter symposium. I was one of the speakers of the symposium. I think there were 4 speakers on male genitalia, and I was the first speaker. I made a presentation and came off the stage. One of the professors started to criticize me. He said, "You didn't talk about the complications. There weren't even one topic about it." Between 2004 and 2013, I have operated on a lot of patients, but we have never had any complication. So I forgot to add that topic to my presentation. There weren't even one topic about it. Professor is okay. Of course, right, because we were in a scientific congress. You have to talk about the complication, those kind of speeches as well. If there isn't any complication, so you have to say that too. He warned me about it, and he was totally right. But then I told them I have been doing the surgery for 9 years and I haven't had any complication since then. Then another professor said, "You say that you inject 70-80 cc fat. 50 cc injector is big enough. Even if you cut the penis and put it in, it still wouldn't fill the injector. You must be injecting the fat around the penis. How can you do this?" He is right. He was right. The amount we inject is so big that it is even bigger than the penis. We do it around the penis. So it was going to really well then, and we had no problems. We really were injecting 70-80 cc fat. After the year 2013 Winter Symposium, 2 patients had an erectile dysfunction. They told me that the penis cannot start an erection and they were having a hard time with that. I couldn't understand the problem clearly because I don't do anything that interferes with the erection. I don't even touch the penis or any veins. So it is impossible for me to create an erectile problem. And I am thinking the possibilities as a doctor, a loss of sense, the veins, penile tissue, blood circulation, we do not do anything that affects them. So it is impossible to create an erectile problem. We couldn't solve the problem, and then a friend of mine who was a doctor and older than me came to my office. He told me that he had a penile prosthesis, kind of an implant. He cannot have an erection, so he had a prosthesis implanted. He said, "I want you to do the thickening surgery, but I also want you to do it at the hospital I work, because the urologist will also be at the surgery and change the position of the implant's button." These implants have a button under the groin. When you press that, it is filled with the serum located near the bladder. So penis will be erected with this method. Basically, implant is filled with the serum. He wasn't comfortable with the position of the button, so wanted the urologist to fix that. I've accepted his offer. I went to the hospital and they told me that there would be no nurse and I would do the surgery with the urologists. And I said, okay, but then I remember something. I have 2 patients who have had an erectile dysfunction. If the urologist has implanted the prosthesis, he must be working on erectile dysfunction. Then I asked him, I have 2 patients who have erectile dysfunction. And the first thing he said was, "How many cc you inject?" When I said 70-80 cc, he said it was too much. First thing he told me was this: "So why did those 2 patients have erectile dysfunction? Because we didn't see that with the other patients." So how does the erection happen? The tissue inside is filled with blood. If the patient had already a slight erectile problem, if the penile tissue cannot erect well enough, when you inject that much amount of fat, blood pumping will be the way much harder. Adipose tissue will wrap the penis like an armor. This code belongs to the urologist. He told me that you inject an adipose tissue around the penis, blood flow is already low and it cannot overcome the pressure of adipose tissue. So erectile dysfunction has nothing to do with a vein or nerve damage. We don't interfere with that reflex. It is all about the mechanism. But patients ask if it is because of the fat amount. No, it's not. Since the fat wraps the penis, blood pumping becomes much more difficult. Adipose tissue intercepts the process. The urologist recommended this to me. Lower the fat amount. How much? Maybe 60 cc. We tried that. When we stop at 60 cc, nobody has an erectile dysfunction. But since then, a couple of patients requested more, saying, "Doctor, I don't have any erectile problems, so you can inject as much as you like." I try to explain them and say that if you have any problems, don't come to me again. But they still want more fat injection. After injecting 70, 80 cc fat, 2 months later they come back saying, "I've started to have an erectile dysfunction, but I have already told you that," I say. There are also two more important topics about this. First, why did this only happen in 2 patients? I have operated on so many patients in 9 years, but only 2 of them had the problem. The urologist said, since the erectile dysfunction is his expertise, I valued his opinion on this. He said most of the patients don't have any erectile dysfunction. So the adipose tissue won't cause any problems in them, but the ones who had this problem before will have much more difficulty with this. So if the patient doesn't have an erectile dysfunction, there will be no problems. But if they do, the problems becomes more serious. This is the reason only 2 of my patients had that problem. So he said, if you have another patient who has an erectile problem in the future, you can have this problem again. And the second thing is that, what did we do with this patient? Nothing. We told them to wait a couple of months. We gave 5 mg of Cialis, milligram Cialis, but I don't think that it helps very much. In a couple of hours, the fat we inject dissolves a bit. It loses some volume. I will explain the reason later. When it loses some volume, the fat amount around the penis decreases and the patient feels relieved. So the problem comes along in time, but the patient calls you and comes and goes in that period. So I advise you to always stop at 60 cc, because when we do it becomes riskier. I say this both for the patient and the doctor. There is also another thing that I can say about the fat injection. Actually, there are a lot of stuff, and I will explain them all. How much fat will remain and how much of it will go away. There are a lot of stupid rumors online. 4 or 60% disappears after a while, etc., etc. Everyone is obsessed with the numbers. Not every patient is the same. Everyone's physique is different. Fat amount is different with everyone, and this amount always changes with people. These are all intricate things that needs to be tackled. I have told you before that fat injection is a very complicated issue. I will be explaining them to you one by one. How much fat will remain? We cannot know the percentage. No one can. It surely will dissolve it bits, but sometimes this amount is so small that the fat remains there for years. A patient of mine from Germany came to me 6 years later. The fat amount was just like we did 6 years ago. So I didn't do anything extra. We still don't know how long it will last. But sometimes patient comes after 3 months and we see that the half of the fat has been dissolved. I have had a patient and their fat injection dissolved completely. Nothing is left because there are also other factors other than the ones I have been explaining to you. This is seriously complicated one. One day, a 25-year-old patient came to me. He said, I have multiple sexual partners and a very intense sexual life, and I use alcohol and drugs. I think you should know about them. We performed the enlargement surgery on him and there were no fat left a couple of months later. 6 months later, he insisted me to do the surgery one more time. Same things happen. Adipose tissue disappear every time we do the fat injection. So I told him that there is nothing we can do about it because I couldn't understand the reason behind it. After 1.5 years later, I had a very similar case to that. He also told me the same thing. I have multiple partners and I use the alcohol and drugs. We performed the surgery and the same thing happened again. Nothing was left. So I am a bit scared of this type of cases since this has happened. I think it's neither because of their physique or drug use. I think the reason behind is that they don't wait for 3 weeks after the surgery. They have sex before 3 weeks and the adipose tissue dissolves in blood. I will also explain the reason for that because you will understand it when I talk about the fat that is injected. As you can see, we have these kind of interesting cases, but we cannot surely know who will have how much fat. We just know very little about it. Adipose tissue does not have the same quality in everyone. We have learned that so far. Sometimes when you remove the fat, you see that it is totally dry. Totally, when you filter it, no liquid comes out. It looks like a mashed potato. I think this adipose tissue will help us the most. Sometimes it is so edematous that it floats inside the injector, so I don't think that this type of fat remains properly. We filter it as much as we can and inject the remaining part, but it doesn't help us very much. So there are 2 types of fat for this, and also I think that some body parts have better fat. I don't think that the fat around the penis is one of them, because that fat is like jelly, and I don't think that it leaves a good sediment after filtering. So why is this is an important point? Because when we inject the fat around the penis, it stays that way for 3 weeks. We do not want the patient to have sex or masturbate. Because if there is any motion around the penis, adipose tissue goes away. In 3 weeks, it needs to die and turn into the fibrous tissue. When it does, then the fat remains there. So the penis needs to stay still during the process. So we need to extract the fat from the parts that hold better. And we need to check its quality when we do it because it varies from person to person. 40% or 30% are just hypothetical numbers and also not true. It changes with every patient. We cannot give an exact number. Will the fat remain inside the penis stay there forever? This question is also asked frequently, and I don't think that it will. Fat dissolution will mostly happen in the first couple of months. It can be 20% or 40%, but I've seen 5 or 6 years old cases, and they didn't have any problem with dissolution. But I still don't think that it will stay there forever because this is a fibrous tissue that turns into a scar tissue. Fat cells will turn into a fibrous tissue in 3 weeks. So what happens during that? Fat cells lose the fluid inside. When it is lost, the cells dry out in some way. Remaining cell residues tighten and turns into the connective tissue. It loses its vitality. I can call that the pastrami process. Like meat is pressed down under heavy weights and it becomes hard while losing the fluid. inside and the residue becomes tighter. I think the injection process is similar to this because after 1 year from surgery, we've conducted biopsy on a group of patients. When they came back 1 year later, they requested another session of fat injection. When we were at the surgery, we've removed a small piece of tissue for sending to the pathology because we were wondering if the tissue was left as an adipose tissue or not. All of the results came back as fibrous tissue. So there is no fat left inside. They all turn into scar tissue. So I think that 3 weeks is the fibrous tissue process. If there would be any sexual intercourse or masturbation during 3 weeks, adipose tissue dissolves. It dissolves into blood. Sometimes they ask me if it goes out through the stitches. No, it doesn't. It dissolves into blood. But after 3 weeks, if when it turns into fibrous tissue, then it won't dissolve into blood since it has a stiff tissue. It feels like an elastic, rigid tissue. This is good because this helps penis to stay outside. It won't cause any erectile dysfunction. I've never heard of such thing. And also it won't change with weight gaining or losing. We proved it with biopsies and there are also pathology reports on this. Other than that, some people think that what would happen if the adipose tissue stayed that way. I have seen 2 examples on this. I talk about the first patient. He called me and said, I've had a penile enlargement operation a year ago. Now one side of my penis has swollen. Can we fix it? I told him to come over to the clinic. I look at his photos from the archive. It looked like a normal penile enlargement surgery. I also checked the surgery footage. Again, normal because I videotape all of my surgeries. When he came to me, I examined him and didn't understand what was going on. I was shocked. I thought some part of the fat was dissolved and there was some left on the other side because he was uncomfortable with the swelling. But the tissue was different. But the issue was different. Penis was swollen 2 times bigger. Some part was swollen additionally by the way penis was soft when I examined him. I thought it was really weird because I've never seen this before. Then we went into the surgery. We opened the penis right from the top. There we saw the adipose tissue and it was all yellow. There were blood vessels on it and it was not fibrous tissue. I was really surprised. We removed the extra part and sent it to the pathology. Then we closed him. There was lipoma on the pathology report. So it was tissue. Adipose tissue was not that, and also lipoma came out of it. But why it was 2 times bigger? Because he has gained weight after 1 year of the surgery. If the adipose tissue stays the way it is, it will be very soft and lipoma came out of it. When he gains weight, his penis will also gain weight. It will also be thicker. This was an extraordinary case, of course. We do not expect this to happen normally. It was weird for the fat to stay that way. But in this case, it did, and it was also an experience for us. We don't want this to happen because this causes penis to soften. Penis also gains weight and lipoma may come out of it. Normally this shouldn't happen. This was an extraordinary case. So why we do not want any action in 3 weeks? intercourse or masturbation, because if the fat dissolves into blood, first factor, number one factor is always motion and movement. For example, when we inject on the face, the most suitable part for it is the forehead. Let's say that the patient fell down when they were a kid and the sinus caved inside. Then there would be a dent there. We do fat injection to the dent and it stays beautifully. It stays there for years, or the jawline. This part also does not move very much, so it stays there beautifully too. Adipose tissue does not dissolve into blood in this kind of body parts, but the lips are harder. When you inject the fat into the lips, it disappears after a little while. It doesn't stay at all. Why? Because even if the patient do not talk, they have to do it. When the lips move, the fat dissolves into blood. You cannot keep it still for 3 weeks. It is not possible. So, fat injection is not a good solution for the lip augmentation because it doesn't stay that way. Just like this, if penis starts to move early, like intercourse or masturbation, fat injection will be dissolving into the blood. So, what kind of modification we have performed on fat injection? Let's mention those shortly. We used to inject 60-70 cc before, but now we only do 50-60 cc. We used to do it evenly. Now we do it evenly, but we also inject extra fat to the glands and the base. We used to inject fat to the visible part, but now we inject the fat to the inner part of the penis. We do tunnelization under the penile skin for the fat injection, and we try to do it crosswise. We inject the fat through the couple of holes. Besides that, the patient should know that the fat injection is not a miraculous procedure, because it is not something that will stay for a lifetime. There will be some loss in the beginning, and how long it will stay we cannot know for sure. Over the course of the years they may need another fat injection. Sometimes they ask me why it's not permanent, which surgery is permanent. I ask you, let me count them. If you amputate the leg of a diabetic person, it's impermanent. If you amputate a finger, it is also permanent. Tonsillectomy is also permanent. Appendectomy is also permanent. None of the surgeries are permanent other than organ removals. So I don't want you to ask me this kind of question. Why is it not permanent? One of my patients asked me if he needs fat injection over the years, so he thinks it will cost him quite a deal. If you think that way, please do not have the surgery. You buy gas when you buy car, right? You buy gas or replace parts if sometimes something happens. So you have to spend money for it. When you do fat injection, you see how long it will last only if you do it a couple of times. If your body is not suitable for it, you won't do it anymore. But if it is last long, it is especially last long at the patient that comes from Germany, and I don't know why. It is much better than the patients in Turkey. Someone comes and says, you did this injection to me 6 years ago. I look at it and it looks like I did it 3 months ago. So it is beautiful surgery for this kind of patient. They come to us 6 years later and we don't find it is necessary to do it again. I don't know, but it may last 6 more years. If they want, they can do it one more time because it is not very expensive if you look at it time-wise. So why is it not permanent? Because none of these surgeries are, other than amputation and tonsillectomy, There are no permanent surgery. You should think it that way. If someone thinks that it will cost them quite a deal, I recommend them not to have this surgery. We try to do these surgeries in accordance with the technique because we cannot change the nature of the body. We check these over the years. We do biopsies and the patient follow-ups. For example, if the fat is edematous, it is also a good experience for us. We can only keep track of those, and I also do this. We remove fat from the abdomen, and let's say it is quite edematous. It floats in the injector. Even if we use the filtered part of it, the fat loss will be too much. I warned them after the surgery, saying that your fat had a poor quality. It was edematous. We use the filtered part, but the loss will be much more than the normal. They say, okay, we will wait and see. And come to me 6 months later, he says, you were right, doctor. Most of the fat has gone now. We also check that and see. I recommend the second injection. We do it one more time. Then we get a really good quality of an adipose tissue. Sometimes the first one can have a bad quality, but it gets better the second time we do it. I think it is related to the seasons or their diet. It is not possible to know beforehand and reassure the patient. But as I've said before, we try to do it in accordance with the technique. We try to make up for the deficient stuff at the surgery. As I've said before, I would have never imagined that a woman holds a penis from the base and feels that it is thinner than the rest. But we have seen this too. Now we inject extra fat to that part, so there are some things we can do. But don't think that the fat will stay there for a lifetime. We don't fool them with empty promises. So how do we do this surgery? We usually do them in the morning around 9 or 10 a.m. and release the patient during the evening. There is no problem with that. The sutures around the area where we put the cannulas in fall off themselves. If the patient asks another fat injection, we do it 6 months later. Let's say he calls me 3 months later saying that most of the fat has gone and asks me for another fat injection. We can only do it 6 months later. So why? Because the adipose tissue around the penis needs to soften a bit. If you try to do it after 3 months, you cannot put the cannula inside. It would be difficult. Another reason for this is the abdominal fat removal. We will do it again. So it also needs to soften. We cannot expect it to happen in 3 months. You can't move the cannulas inside very easily, so we need to wait for it. Besides that, the patient shouldn't be having intercourse in 3 weeks' time. Penis needs to stay still. Also, no masturbation. After 3 days, they cannot open the dressing and take a shower. There is also one more issue. You can have a small pain first days after the surgery, but it goes away when you start to have intercourse. I also have a funny story about it, but I will tell that in my after the surgery video when I explain about what the patient should do, how we do it, and when should they have an intercourse. So this will be exciting for you because it was really interesting. Well, these are the things you need to know about the thickening. There must be some stuff I forget about even if I wrote them down because there are so many things to talk about, but fat injection has so many factors and a little bit unexpected. We cannot see the quality of the abdominal fat. For example, we cannot know how many of it will stay after the injection, his physical intercourse frequency, whether he has sex before 6 weeks or not. These are different factors. So the thickening surgery reserves a lot of unexpected things inside. And I think the thickening surgery is the most important procedure for sexual intercourse that we cannot do, is to explain all the positive and negative. If you've got any questions, you can ask me through the telephone numbers that I've been giving over here just underneath my video. See you in the next video. Bye.